Good morning. It's been a few months since we've taken the time to have a town hall media presentation on our COVID-19 status that includes our vaccines, our boosters, and our testing capacity here in Genesee and Orleans counties with our public health department. Thank you for joining us this morning. And with me today, we have Matt Landers, the Genesee County manager, and also our pandemic leader, Paul Pettit, who is our public health director. It would be remiss for us not to take a moment and to thank with our full hearts the leadership in the Department of our public health and all of the staff that has given so much to our good public health here in Genesee and Orleans County over these last few months, almost 2 years now. So thank you very much to each and every one of the staff members. I know yesterday I was out to get my booster in Genesee County, and it was absolutely endearing to see all of the friends that we had worked with at our testing clinics and our vaccine clinics. They remain on the job, and it is with full hearts that we are thankful for the role that they have played in getting us back to good public health. Thank you very much. And with that, I'll turn it over to Matt Landers.
Thanks, Shelley. I don't have a lot of updates here. This is primarily for Mr. Pettit, our public health director, to give us all the wonderful updates that are out there. I know we hear from time to time members of the public that ask us what's new, what's going on. They haven't seen us lately. So we try to have these as frequently as we know that the public in our community wants to hear from us. It has been a while. I think late August was the last time we had this. But in recent weeks and months with the booster availability and now with kids having the ability to get the vaccine, we thought it was a good time that Paul can give some updates, specifically how those operations are handled here in the county, and give people some updates on how they can go after these treatments if they so choose. I also got my booster last week, and I'm thankful for it. I recommend everyone to get their vaccines and boosters if they're eligible. I'm very, very happy, as Shelley has said, with the work of our health department. It's been simply amazing over these last 18 months now. A tireless effort, and I'm continue to be amazed by the work they put out. I am available for questions, as Shelley is, but I believe the vast majority will be coming to Paul, rightfully so. So without further ado, Paul, you're up.
All right, good morning, everybody. Thanks, Matt, and thanks, Shelley. Again, it's always a pleasure to be able to do these with everyone. It has been a couple months, I believe, which necessarily isn't a bad thing. I mean, we've kind of been doing our thing in the background and pushing vaccines and making sure that we're keeping on top of things and doing the contact tracing and doing everything we can to make sure our public is aware and is educated and as safe as possible. But obviously there are some things that have changed recently over the last few weeks, particularly with the expansion of booster shots. Now with the approval of the 5 to 11-year-old child vaccine that obviously has been anticipated for quite a long time, that has now been approved and actually in hand locally. So we're going to talk through a few of those things, but I do want to go through, give some updates on some data points where we're at. Again, we continue to share these a couple of weeks. A couple times a week, we post these up with updated numbers for both counties on our website. And I know especially our local news outlets typically grab these and post them and share, but we are tracking data locally. We are monitoring how things are trending up and down. And overall, we're going to continue to be transparent and share that information through, again, releases and posting at least 2 times a week. I do have Nola Goodrich-Cressy, one of my public health educators, on right now. So as I kind of go through this information, she's going to be posting some different links in the chat. So those of you that are recording it or want it for reference points on different places you can find some of this information we're going to go through, feel free to grab those out of the chat. We will be obviously opening up the questions at the end if there are any, and we'll announce that when we get to that point. But as Shelley and Matt both articulated, we are approaching 2 years now, with at least the identification of COVID-19, hence the 19, right? It was first identified in the end of 2019, and That's quickly approaching 2 years of having this virus circulating within our world. And obviously we didn't start seeing local cases till after the first of the year in 2020, but it has been around for a while, and the response to this is well past 18 months in preparing and actually starting the pandemic response. So it has been a long time, and again, I would be remiss if I didn't give a shout out to my staff and those working alongside of our staff. We still have a lot of volunteers that assist us on a regular basis at our testing and vaccination clinics. But the work remains long, it remains hard, and the staff are tired, they're weary, but they're troopers, and they're hanging in there, and they're very mission driven. We should be very proud in both Genesee and Orleans County to have staff that care about their community and come to work every day and continue to slog forward as this pandemic continues to plug ahead. So just a shout out to them for all their hard work and efforts that they continue to do on a daily basis for all of us. All right, getting into some things. So positivity rates, if you're following along, have remained fairly steady in both Genesee and Orleans County over the last couple months. We obviously saw that uptick through August when the Delta variant was really settling in our area. At this point, we've seen pretty regular numbers. We're hovering right around 20 to 30 positives per day in both counties, with our active cases typically around 200 to 225. Again, people come on and they go off every day as they go on isolation and clear. But overall, they've remained fairly steady. We have noticed over the last week or two, though, there has been some regional uptick in cases. This isn't necessarily something to be unexpected. It is getting colder out. There's some frost. I know snowflakes have been flying locally. And with that, behavior changes. Obviously, we've been outside with gatherings. We've had our windows open. There's been a lot of fresh air. And as we start to come indoors now, there's obviously increased exposure risk, not just to COVID, but flu and other respiratory illnesses, other viruses, as we start to congregate in closed settings and spending time indoors for birthday parties, retirement parties, gatherings, holidays, etc. It is expected that we are going to see a slight uptick in cases just due to that social behavior, which is why it's very important that we start to think back on some old habits that maybe we got out of a little bit over the summer with social distancing, hand washing, staying home if we're sick. We've been beating that drum beat throughout this entire pandemic. Prior to that, with our flu messaging, but the reality is, we just want to be very cognizant to remind folks as we do start to move back indoors and change our behaviors a bit. And now more than ever, we need to start refreshing some of those different strategies, mitigation strategies, to try to minimize the spread as best we can. And it's going to be incumbent upon all of us to make those types of decisions when we're with others and gathered, especially in places of unknown vaccination status of potentially people, and areas where we have folks gathering that, kind of the mixed crowd. So those are areas where we may see some spread and some clusters form. So again, just reminders to be COVID smart and think through some of those mitigation strategies and techniques that we can do to try to minimize spread. Now, we're not going to stop it per se, but at least we want to minimize it and try to protect those, particularly that are, potentially, at risk for higher severity if they do happen to come down with COVID. So some quick numbers. Genesee County, to date, we're at 7,310 total positive cases. We have 222 currently active on isolation, with 15 of those active cases currently hospitalized. There's been 6,459 community recovered cases, and that technically means they've been removed from isolation. So after the 10-day period, if they're no longer symptomatic or symptoms are improving, we remove them from isolation and we no longer follow them. Currently to date, there's been 135 deaths in Genesee County per the New York State Department of Health data page that are attributed to COVID-related deaths for Genesee County. And our average 7-day positivity rate in Genesee County is around 8.1% of all tests. In Orleans County, we're at 4,674 total positives with 212 active cases, with 8 of those in the hospital, 4,026 recovered. Again, unfortunately, 90 deaths attributed to COVID per the New York State data point. And our 7-day positivity rate in Orleans County is at 7.8%. And again, those numbers fluctuate up and down a little bit as more testing comes in on a day. That number may drop down. If less testing, it's holding up there, anywhere anywhere for 6, 7, 8%. So again, we're continuing to track that. And it is a good indicator of, how much testing is being sought in the community and, how much we are finding as far as active cases. So that's currently where we're at. And again, this information is released a couple times a week with updates on total number of positives and active cases, et cetera. So we encourage folks to follow along with that if they are interested. Want to touch briefly on breakthrough cases. So there's been a lot of discussion around that. Obviously, we have a lot of fully vaccinated folks, which that number continues to go up day by day as those trickle in. But we have been tracking breakthrough cases, and these are, again, fully vaccinated individuals who have come down with COVID. And this is our local data. The numbers I'm going to share right here are covering August 1st through November 1st. So we've been, going backwards here, capturing this data point. And this, obviously, these are investigations that are complete, but there may be some discrepancies in some of these numbers just due to positive individuals, may not be able to get the full story. Some of them haven't been interviewed. In some cases fully. Obviously, we're relying on the state contact tracers to assist us in these investigations. But these numbers are in general pretty close to our breakthrough cases locally. So in Genesee County, there's been 1,891 new cases since August 1st. There's been 445 individuals fully vaccinated, 1,259 individuals not fully vaccinated or unknown status. So we're seeing around a 27% breakthrough case in Genesee County for fully vaccinated folks. In Orleans County, 1,483 new positive cases since August 1st and 331 individuals who were fully vaccinated. So that leaves us with 1,016 who are not fully vaccinated or unknown status at a 25% breakthrough case. So we've been sharing this pretty regularly with folks that we talk with and on our different data point sites. And that's been pretty consistent over the last 3 months, that 25% or so breakthrough case locally. And that holds up pretty close with other counties that I've talked with and that I know around the state. In some cases, actually higher than that percentage, and a lot of it correlates directly to vaccination percentages. Obviously, the more of your folks that are vaccinated, it's going to correlate to potentially a higher breakthrough case with your numbers. So of those breakthrough cases, most of them in general have been very mild symptomology, not severe, which again is, backs up and supports the efficacy of the vaccine and the importance of getting vaccinated. We know with Delta that there has been more breakthrough cases, hasn't aligned quite as well as it did with the Alpha variant. But it is working. It is preventing disease, but it is also preventing severity and keeping people out of the hospital, and most importantly, keeping people from dying of COVID. So that's just a little bit on the breakthrough data. And again, there's more information on that available through the state website. Just a little bit on vaccination updates. So obviously the COVID-19 vaccines are available, as I mentioned, and are our most important tool in helping prevent COVID and prevent the spread of COVID. They do protect against infection, but they, in getting COVID, but they are most important in preventing severity. So that's why we strongly encourage folks to continue to seek out vaccines. I'm going to share a little bit of our vaccination numbers shortly, but I want to talk a little bit about the 5 to 11 vaccine that was just approved. So this happened over the last week or so. There was meetings of the advisory committees late last week. The FDA met, and then as of Tuesday, CDC has signed off on approving that for use in the U.S. and in New York State. That was quickly followed up and approved by the State Commissioner of Health, so that we can now administer vaccine to 5 and 11-year-olds. And this is the Pfizer vaccine under again, emergency use authorization. It's a little bit different than the full dose Pfizer vaccine for adults. It's actually a third of the adult dose. Same time period, you're going to have a dose on day 1, and then you'll also be given a dose 21 days later to be fully vaccinated. And again, it'll be 2 weeks after that second dose that anybody would be considered fully vaccinated. So it's a 5-week period, technically, if you look at it from start to finish when you get your first dose. But again, it's a third of the dose. And again, that was what was used in the trials and tested. And that third of a dose showed sufficient antibody response for kids in that age group, and has been shown in the trials to be effective at, again, preventing disease and preventing symptoms in those who may, again, acquire disease after being fully vaccinated. Again, the COVID-19 vaccines have undergone the most intensive safety monitoring and, through the development of it in U.S. history. Vaccinating children will help prevent and protect them from getting COVID-19 and therefore reduce the risk of severe disease, hospitalizations, and developing long-term COVID complications. We also know that it's very important for them to get vaccinated to help, number one, them from getting sick, but also spreading the disease to others. We know that they can be carriers, even if they're asymptomatic, and they can bring, obviously, COVID back home to their loved ones, including those that may be more susceptible to severe illness, even if they are vaccinated, as we just talked about breakthrough cases. So this is the next tool for us as far as moving forward, this childhood vaccine and helping us move forward and getting out of this pandemic. Is trying to, again, protect others and get them vaccinated. We do want to encourage anybody and everybody with children in this age group to talk to their healthcare provider. We're not giving medical advice here. We are talking about the vaccine and the importance and the role that it will play in protecting children. But ultimately, every child has their unique medical history, just like we all do as adults. And we want to make sure that any parents that have any questions or concerns, just like we do with adults, to become educated, to do your research, to evaluate and look at your own individual situation with your kids, and talk to your doctor, and have that discussion with them. But again, that is an encouragement we've had from day one here. It's important to have those relationships and those conversations, but we want folks to seek out factual information and that will help them to make an informed decision for them and their family. I will talk a little bit more about our upcoming clinical activities related to kid vaccines and et cetera in a minute, but I do want to touch on booster shots quickly. So again, booster shots are now available across the board for all three vaccines. So depending on what you had, J&J, Moderna, or Pfizer, you are eligible for a booster shot. You're also available for mix and match now. That has also been approved. So depending on what vaccine you may have received the first time around, if you want to try something different, that has been approved and has been shown to be safe to be able to move to a different vaccine. Again, that's completely up to the individual, and if there are questions on that, I would encourage people to do their own research and talk to their healthcare provider. What we have seen so far is most people are sticking with the original vaccine that they received the first time for their booster shot. But again, for the Pfizer and Moderna vaccine, if you are seeking out that booster shot, which we would recommend, it has to be at least 6 months from your final vaccination shot. So there's kind of a time frame there. So you can follow along with that depending on when you were vaccinated. There are recommendations out there for the booster shot currently. Anybody that's 65 years or older, anybody 18 years of age who live in long-term care settings, anybody 18 years of age or 16, I guess, with it's actually lower down with the Pfizer, but who have underlying medical conditions. And again, there's a website where folks can go on to determine if they fall under that. And then in addition, anybody eligible for the vaccine who works in or lives in high-risk settings. So this is a very broad list, but it includes first responders, healthcare workers, firefighters, police, congregate care, education, food workers, agricultural workers, et cetera. Bottom line, if you're interested in the booster shot and you believe it's right for you and you're ready to make that decision, you should be able to seek that out and receive that, whether at a pharmacy, your healthcare provider, or at one of our clinics. Jumping over to the J&J, that is also approved if you're 18 years of older, which is what the vaccine is indicated for. That's a little bit different than the Pfizer and Moderna. This is recommended at least 2 months after you've been fully vaccinated, and the J&J was only 1 shot to start with. So the time frame for that is only 2 months compared to 6 months. So that's one of the primary differences. So if you are seeking out that booster shot for J&J, it's got to be at least 2 months, same type of criteria as I just mentioned. And again, if you wanted to switch over to Moderna or Pfizer, that option is also available. We do believe the general public additional populations may be recommended to receive booster shots as more data becomes available. But as of now, it's kind of in line with that list that I just mentioned. And again, people can seek out and see, again, who qualifies for those booster shots currently by referring to the CDC website. One thing to note on the Moderna booster is that it is a half a dose. It's not a full dose. So again, through Moderna doing their studies and looking at their data, half dose has been shown sufficient to produce the type of immune and antibody response that we're seeking. So if you are coming for your Moderna, you are not going to be receiving a full dose, you'll be getting a half dose. If you're looking at Pfizer or J&J, those are full doses. So again, there's just a little bit of nuance, differences there. The booster shot in general is just to, again, give that boost to the antibodies to make sure that we're protected as we can be. As I mentioned, we are seeing more breakthrough cases and, having the opportunity to boost up your immunity to help, number one, prevent the disease, but also more importantly, to prevent severe illness and hospitalization is why the booster shots are currently being recommended now, especially with the Delta variant circulating. It's just important to try to, again, make sure we're as strongly and most protected as we can be. All right, so I'm going to talk quickly about third doses. So this is a little bit different than booster shots. It actually may end up being the same vaccine for someone, depending on what you're seeking out, but third doses have been available now since late August. Prior to booster doses being approved. So we have been giving those out, and I know we've had a lot of folks come through our clinics and seek this out in the community. Third doses are only available for Moderna and Pfizer. The CDC does have recommendations for those with compromised immune systems that are eligible for the third dose. And again, there's a list there, but these are people that have been receiving active cancer treatments for tumors and cancers of the blood, organ transplants, stem cells, other immunodeficiency suppression illnesses, advanced or untreated HIV infection. So there's a list, again, that we refer people to. We'd encourage you to talk with your healthcare provider, as we've mentioned many times already in this talk. But the third dose is for, again, Pfizer or Moderna, and it is a full dose. So again, with the Moderna, this would be a third full dose versus the half dose of the booster shot. So again, if you fit those categories, you may have those underlying health conditions. The recommendation is for the full third dose of Moderna. If you're not in that category, but you fit the other described descriptions, you would be receiving a half dose of the booster shot. So again, some nuances there. We want to make sure that at least out there and the people are aware of it. Those that do come through our clinics, you will have to attest that you do meet those requirements. It's a self-attestation. We're not looking for documentation. You don't have to bring in a doctor's note, but you will have to self-attest that you do qualify under the requirements of the vaccine currently. All right, so I've talked a little bit about the different types of vaccines, different opportunities that are out there. Moving over to the clinical approaches here for both Genesee and Orleans County, we've been vaccinating and testing all along since those were available. Almost a year ago now is when we started doing our testing and our mass vaccination testing clinics in Genesee and Orleans County. As far as vaccinations are concerned, we are vaccinating 1 day a week currently. In Genesee County, that's on Wednesdays, and in Orleans County, that is on Thursdays. We'd encourage everybody to go to the health department's website. Signing up for the clinics is fairly easy there. We have it hopefully laid out fairly intuitive so folks can understand and follow along with that process. But ultimately, folks are able to go there and, again, sign up for whatever clinic they have. There's different buttons. If you're looking for a booster shot, your first shot, the childhood shot, you can, again, pick the different type of vaccine you're looking for. We have them all at the health department. So if you're looking for Pfizer, Moderna, if you're looking for kid vaccine, if you're looking for the booster shot, we have it all. So we'd encourage you to, again, have those conversations with your healthcare provider and come see us if you would like to receive those with us. Again, several of our larger pharmacies, chain pharmacies, are vaccinated in both counties, and there are many providers that are also vaccinating. And, we don't really have any persuasion on where you go. We just want you to go. So, make sure you make that call or sign up for whatever type of shot you may be looking for. Today is a good day to do that. All right. A little bit on data around vaccinations. Again, I'm going to go through this a little bit quicker because this information is readily available. But, looking at how we're doing around vaccinations, and again, these reference New York State data points that are, again, out there and available if folks want to look. But currently around New York State in general, 74.4% of the population has at least one dose. If you look at 18 and older, it's 66.8% of the, or I'm sorry, 18 and older are 77.4 with one dose. 66.8% of the total population and 78.8% 18 and older have completed the vaccine series. If you look at New York State population totals, there's 14,364,966 folks with at least one dose, 71.5% at least one dose, and 64.9% with a completed series. And again, that's looking at the whole population, not just 18 and older. As we drill down a little bit closer to Genesee and Orleans County in the Finger Lakes, again, we've talked about this many times. We're in the Finger Lakes region as far as our placement with who we compare data with. There's 72.9% of the population with at least one dose and 66% of the population with the completed vaccine series. Genesee County, again, drilling down a little bit more. We're at 64.6% of the population with at least one dose and 58.6% with the completed vaccine series. And it does vary by age group. Our highest percentage age groups are obviously in the senior population. 55 and older and above are at 73% or higher. The highest group is 65 to 74%, which is almost at 83% vaccinated. Jumping over to Orleans County, we're at 61.2% of the population vaccinated with at least one dose and 53.6% with the completed or fully vaccinated series. And similar to Genesee County, our highest population numbers percentage-wise are in the older senior populations. Anybody 55 and above, we're at almost 70% vaccinated with our highest range at 65 to 74 years of age. All right, shifting over to testing a little bit. Limited testing is being offered at both health departments continuously on a weekly basis. We do testing typically on Tuesdays in Orleans County and Fridays in Genesee County. Unfortunately, at this time, we do not have any PCR tests available through the health department. We do have the Binox cards, which is the rapid antigen test. This test is effective. It's a rapid test, but it does not qualify as a PCR test. So anybody that's seeking out a PCR test, unfortunately, we're not able to do that at the health department. There are locations within the community excuse me, and nearby that you're able to get that and seek that out. We'd encourage anybody to look at the New York State Department of Health testing test finder page. There are, obviously you can put in there your zip code and it will give you any available local testing opportunities to seek that out. You know, one thing to note is it varies on what's acceptable where. So we really encourage people to talk with your healthcare provider if you need a test done to go in for a medical procedure, if you're traveling. If you're going out of state, out of country, again, airports, different destination areas require different types of tests sometimes. So we have had some frustrated people where they come get the antigen test and then they find out they needed the PCR. So we would encourage everybody, especially with travel coming up for holidays, Thanksgiving, Christmas, to look ahead. If you are required to get testing done prior to travel or prior to, again, going into the hospital for a procedure, you verify what type of test is done and accepted, and then you can seek that out. And we're happy to, you know, take care of your needs here at the health department if our tests match up with what you need. But I want to just put that out there. Check ahead. Please verify so that everybody can get what they need. A little bit on home testing. We touched on this last time. Home testing is playing a more and more significant role in, you know, helping folks identify if they do have COVID. It's kind of a double-edged sword. It can obviously help people know they are accurate. They're very similar to the Binox test that we do. The only challenge with at home is they're not medically overseen and there's no verification in how it was done and completed. So we unfortunately are unable, for the purposes of officially documenting positive cases, to recognize those at the health department for isolation and quarantine. You know, so if people do take them because they're not feeling well and you do test positive, number one, we need you to obviously stay home, do not go to work, do not go out into the community at that point. Contact your healthcare provider, you know, and contact the health department. We can walk you through the next steps in the process of isolation and quarantine and making sure, you know, we can try to cut off that case from further spread to other folks in the community or other close contacts. But again, if you do test positive, you should self-isolate for a minimum of 10 days. That's the incubation period and the duration here that, we need to keep folks home so that they're not potentially shedding that virus to other folks. So again, that's that 10-day period, but we would encourage you to contact your primary care physician and or the health department for further instructions if you do an at-home test. All right, so jumping over to guidance, real quick on schools, just want everybody to be aware, I do talk regularly with our school superintendents in both counties. We typically have a conference call every week. So there is a lot of dialogue going back and forth, and we are well in tuned in discussing what's going on at the schools currently. And, we've seen the percentages of kids in school kind of fluctuate since the beginning of the start of the school year. I would say on average, we're probably around 15 to 20% of our active cases are in school age kids, not necessarily indicating that it's school related spread, but these are kids that are positive. So, and again, that number does vary up and down. But ultimately, we are monitoring. Our schools are doing well. I know that, obviously currently at the moment, masking is still required by New York State indoors at all schools. Obviously, this has been frustrating for many parents, and it's been controversial, but ultimately we have seen a significant improvement in the reduction of quarantines in students this year. And what that has allowed for is better continuity of education. The kids have been able to stay in school and continue to learn in the in-class environment, which is something that our superintendents have been very vocal about in wanting to make sure we can keep these kids in person and keep them learning and keep that continuity. So, the masking has helped to reduce spread and to keep these kids, most importantly, off of quarantine and in person in school. And so we've done much better this year than we had last year, where we had, whole classrooms, whole grades out of school for significant periods of time. So we are pleased that some of these strategies are working. Just keep in mind that the masking requirements and some of these that are in place, these are state and national driven. We do not have local autonomy currently as far as making some of these decisions, but we continue to advocate and we continue to monitor, and we're going to continue to do our best to keep these kids safe and keep them in school so that they can have their educational opportunities throughout this upcoming year. The other thing I want to talk about currently is this, and I know there's a little bit been out on the test to stay approach, that there was a guidance document put out by New York State Department of Health last week around this potential new option that is available if counties and schools want to undertake this. Again, I have had conversations this week with both Genesee and Orleans County superintendents. We are discussing this. There are a lot of logistical and supply challenges that come along with trying to implement a program like this. And essentially the concept is instead of having students out on quarantine for their 10-day period, they would be able to attend school, only the academic component of it. After school activities in the evening, et cetera, they would still be on quarantine like they normally would be, but it would allow them to be in school. The challenge is they have to be tested every day prior to entering school. Again, this puts a high demand on the availability of testing supplies, capacity and staffing to be able to carry out this significant increase in testing. Obviously, there is a potential opportunity to help these kids, again, as I mentioned, stay in school more and to be able to have that in-person learning. So we are exploring this. We're looking at our different funding streams to see if we can, put together the resources to be able to purchase the supplies, to get the staffing we need to be able to carry this out. Those discussions are underway. One thing that the state was very clear is that there has to be equity and parity in how this happens. One school necessarily can't do this on their own if it's not available to the other schools throughout the county. So again, we are looking at this as a county-wide approach, and we should have more on this in the next few weeks. Again, this is going to take a little bit of time to implement if the decision is to move forward. But I did want to talk about that a little bit briefly because I know there have been some questions on where many of the counties are with this test to stay program. And this is not unique to us. Every county across the state is currently looking at this and whether they can feasibly move forward with this type of approach and program in their county. As far as masks are concerned, again, currently both Genesee and Orleans counties are categorized as high level of community transmission by the CDC. That has not changed. We are well above the 100 per 100,000. With the numbers I just shared, we're significantly above that, and it's going to take a while for us to come back down below that. So we are still in the high transmission level. So CDC does still recommend masking indoors, especially in unknown crowded settings, and this is for both unvaccinated and vaccinated folks. But there are no local mandates in place in Genesee and Orleans County. These are recommendations. But as I mentioned earlier, with the holidays, with people coming back indoors, we'd encourage folks to consider different settings, whether masking is the right answer for them in those areas. So holiday celebrations are coming up. We just had Halloween, we have Thanksgiving, we have Christmas coming, and it's just very important, again, as a reminder that we need to work together so we can enjoy our safe holidays, we can enjoy travel, and we can protect our own as well as the health of our family and friends as we start to undergo and get together for these different settings. So we encourage folks to continue to follow public health precautions, washing your hands frequently. Again, we've talked about maintaining social distance. Do your best to keep 6 feet away from others, especially for longer durations of time, especially over 10 minutes. Wear that face mask indoors, again, is that recommendation. And most importantly, we've talked about this a lot, stay home if you're sick. We're starting to hear a lot of sniffles and coughs in the offices as people are coming in. A lot of people say, it's just a cold. Well, I will tell you that a lot of people we talk to have COVID say it was just a cold, I thought. It was just an allergy. It was just one sneeze. The problem we have with COVID is it mirrors flu. It mirrors other illnesses, right? Other infections that folks may have. And you really don't know until you do go seek out that test and get it. So the best thing we can do is stay home, and seek out that test till you know it's not COVID related. Talk to your healthcare provider, but staying home is going to be key. We did very well last year with flu and other illnesses in the workplace, particularly because people stayed home when they were sick. And, it works when you're not in the office and you're not out and about spreading your germs, that does help. So we'd encourage people to take those, measures. And, most importantly, we've talked about getting vaccinated. It's going to be available for 5 years and older now. So that availability is growing. So we'd encourage, again, folks to go out and get that vaccine as soon as they can. If you are considering traveling for the upcoming holidays, we'd encourage you to visit the CDC's travel page. Again, there are some recommendations and requirements out there for travel. So we'd ask you to be travel aware, to travel smart, and just expect, especially if you're on the airlines and other public transportation, you are going to have to wear that mask at all times per the federal requirements. All right. So I'm going to wrap it up there. Just want everybody to be aware that, we are still in the midst of this pandemic. We're moving through it. Hopefully we're gaining some ground day by day as more folks get vaccinated. Hopefully we're moving closer and closer to officially ending this pandemic and moving more towards more of an endemic approach where, COVID is here. We're moving towards living with it in more of a longer term way. And, as we move that direction, we need to just continue to remember those mitigation strategies that I've talked about a little bit here. We are entering flu season. Get your flu shot, get your COVID shot. Let's protect ourselves from both. They are both available and they're both effective, again, at preventing severity of disease. So with that, I'm going to open it up for questions. As we typically do here, make sure you state your name, your affiliation. Matt and Shelley are both on here, so if there's a question more geared towards them, I'm sure they'd be happy to take a stab at it. If we do not have the answer for you today, again, Nola's on here and we are taking notes. We will be happy to get that answer back out to you as quickly as we can. So with that, I'll turn it over for any questions. Thanks.
Hi, this is Mallory Diefenbach from the TV Daily News. I was with activities starting to increase with holidays and stuff like that. There might be less concern or vigilance among the public of the severity of the COVID situation. And I was wondering, what is the public health doing to prevent apathy among the public or to maintain diligence?
Can you just clarify that question? So what is the public's?
With the holidays coming up, there might be less concern or vigilance among the public about the severity of the COVID situation, and I was wondering what you guys are doing to prevent apathy among the public and to maintain vigilance.
Yeah, no, I mean it's a great question. So what we're doing today is one of them. Getting communication right and talking about it. Obviously, at the health department side, we do a lot of press releases. We push information. We have it on our website. We talk about that COVID is still here. I mean, you hear that adage a lot that I'm done with COVID. I'm over it, right? Well, I am too. I'd like to be personally, but the reality is the flip side of that you hear is COVID's not done with us. We can't really pick and choose. I think when the virus is done, because I think we all would have said, a year ago at this point. So, apathy is there. Frustration is there. We hear it every day. We handle a lot of calls. I talk to a lot of people every day who are frustrated, who are just, fed up. They want life back the way it was. They don't want to deal with masking. They don't want to deal with isolation and quarantines. And we hear you, we understand you, we don't necessarily disagree with you, even personally. So, the reality is, unfortunately, though, we still have this virus spreading. We still have people in the hospital. We still have people dying. Until we get to the point as a nation where, some decisions can be made to maybe change some strategies, which, again, we've been talking about and we continue to encourage some discussions on how we move forward through this. And again, more to that endemic approach versus pandemic. We need folks to persevere. It's a challenge. We want people to think of others, and we know that a lot of people do okay with COVID. They may have some mild symptoms. They may struggle a little bit. Unfortunately, we don't have a lot of people in the hospital, but we do see people in the hospital. And we do see people in the ICUs, and ultimately, as we head into the holiday season, it is a time of giving, it's a time of thanks and recognizing others. Part of that can be being COVID safe and being COVID aware. And so the more we can think of others through, wearing a mask and staying home if you're sick and all those strategies we talked about, the better we can protect ourselves and protect others. So it's a long haul. We hear the frustrations, we hear the apathy. All we can do is really encourage and continue to people to be steadfast and continue the course as best we can, even pushing through some of those anxieties and frustrations.
Great, excellent. Thank you.
Yep.
Paul, I'm not sure. There's a question that came through. I'm not sure if you're seeing that through the chat.
No, let me open that up. Okay, so the question is from Mike Pentinella at the Batavian. Is there discussion about what percentage of 5 to 11 or 5 to 18 vaccinated would have to be completed before some restrictions in schools modified or lifted, especially around the masking? So Mike, we haven't received any verification one way or the other of what percentage we'd have to reach. We know locally with our data, at least 12 and older who've been eligible for the vaccine. We're not, I think where ideally we'd like to be in Genesee County, the 12 to 15 age group, we're at 35% vaccinated. The 16 to 18 at 52.3. In Orleans County, we're at 39.1 in that 12 to 15 bucket and 47.1 in the 16 to 18. 5 to 11 just started, so I'm sure we don't have very many there yet. But as far as the masking, that's going to be a decision, most likely that's going to be carried out at the state level, not locally. I think reading the tea leaves, more than likely masking will be staying in place into the near future. Particularly through the higher seasonal illness that we talked about earlier, as far as whether it's COVID or flu or other respiratory illnesses, masking have shown to be effective at reducing some of the spread. So, we'll keep an eye out on that and obviously share if we hear anything, but we don't have necessarily a percentage. If we hit, 60%, we can lose the masks, if that's what you're asking. So, most importantly, we want to encourage that, get more kids vaccinated, reduce the spread. Again, another advantage even for these new 5 and 11-year-olds that are eligible, if they are exposed as a contact and potentially identified to be on quarantine, similar to the 12 and older now, there would not be any quarantine if they're asymptomatic. So there's another advantage of being vaccinated. They would be able to potentially avoid quarantine on an exposure.
All right, Paul, I think that is about it. I think you answered all the possible questions in your lengthy and informative update, and I think you did a great job covering everything that we possibly ask. Shelley, any final parting words?
I don't, but I believe it is absolutely imperative that we do suggest that all of those that are eligible to receive the vaccine, that they do so, and those that are eligible to receive the booster, do so, because without recovering our public health, we do not recover our economy. We do not have families that will be gathering in the ways that we would like to gather, as we have almost been held apart for these 2 years. And Paul, your comment about people are frustrated with COVID-19, it is apparent every single day, but we are not through this yet. So in my final thoughts, it's think about others. Think about our kiddos who cannot be held safe from this through the use of a vaccine to prevent severe illness. Those little guys and gals, they're our future. So let's really think about protecting them, as we are thankful for them in this month of November. Thanks very much, Matt, Paul, again, and hats off to your staff and your leadership. Thank you.